Are you struggling with sciatic leg pain? I've helped thousands of patients find relief in just minutes a day. And today I'm sharing 4 simple sciatica relieving exercises you can do at home. No equipment, no medications, just fast, effective relief. In this video, you'll learn a 10-minute routine that's proven to relieve sciatic leg pain safely. Plus, stick around until the end and I'll reveal the 4 exercises you should absolutely avoid if you have sciatica. These could make things worse. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I've been helping patients overcome chronic lower back pain, sciatica, and neck pain, all without medications, using specific chiropractic corrective techniques. If you're busy with work or home life and dealing with chronic spinal conditions, this channel is dedicated to you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain, so you can stay active and pain-free. Before I dive in, subscribe to my channel if you want more tips and strategies to achieve a lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. In a minute, I'll demonstrate these 4 sciatica relieving exercises. The purpose of these exercises is to relieve pressure on the sciatic nerve, reduce inflammation, and improve flexibility in the lower back, hips, and legs. That's why they work so well. By targeting the root cause of sciatic pain, such as tight muscles, nerve compression, or restricted mobility, these stretches help you find relief quickly and safely. Let's get started. Okay, so exercise number 1 that we're gonna do for sciatica pain relief is gonna be the single knee to chest stretch. Now I picked this stretch because it's a great way to help relieve pressure on the lower back and on the glutes where the sciatic nerve runs down. So this is an easy stretch to do. You can lay on your back on a yoga mat or on a couch on your bed, either way. And all we're gonna do is we're gonna take one knee, we're gonna bend the knee, and we're gonna start to pull that knee toward the same shoulder. We're gonna pull it as far as you can and we're gonna hold it. And we're gonna start with a solid 30-second stretch. So we want a nice slow count. So 1, 2, 3, 4, 5. So I can really start feeling the pressure kind of relieving in the glute area and a little bit of tension kind of in the front of the hip flexor and the quadricep. So where do you feel most of the tension? Let me know in the comments below. So we're gonna start with 30 seconds. And then when we get to a 30 seconds, we're gonna do the same thing on the opposite leg. So we're gonna take the left knee and we're gonna pull it towards the left shoulder and hold for another 30 seconds. And that's gonna be exercise number 1, which is the single knee to chest stretch. So start with a 30-second stretch on both sides. You can work your way up to you're even doing 2 minutes of stretching on each side. I usually recommend do this stretch at least once a day, but even better, do it like first thing when you wake up in the morning, maybe later in the day once you're getting into the bed. The more you stretch, the better you're gonna feel. Okay, exercise number 2 is gonna be the seated hip rotator stretch. So you're gonna love this stretch. I picked this one because it especially works on the muscles around the hip, especially the piriformis where the sciatic nerve runs through. If you're like a lot of my patients, you sit all day long and these muscles naturally get really tight. So what we're gonna do is we're gonna sit kind of on a couch or on a chair. We're gonna cross our legs to kind of do a figure 4. I'm gonna apply a little bit of pressure to this knee, keeping my back straight. I'm gonna gently bend forward just a bit until I feel that stretch deep into that right hip, the right glute. And just like the earlier single knee stretch, we're gonna hold for 30 seconds. I'm really starting to feel the burn in kind of the glute and the piriformis area. Perfect. And then once we get to 30 seconds, we're gonna do the same side. The opposite side, sorry. We'll cross our left knee, apply a little bit of pressure, bend forward, keeping the back nice and straight. And you'll start to feel the stretch kind of into that glute area again. So you feeling the relief yet? Let me know in the comments. All right, and then once we get to 30 seconds, again, we're gonna gradually add time until we get to 1 to 2 minutes. Again, do it at least once a day. Bonus points if you do it twice a day. Okay, now we'll move on to exercise number 3, which is going to be the sitting hamstring stretch. Now I added this exercise into the routine because, as I mentioned, most of my patients are office workers that sit behind computers all day long. And when they sit for all day longs, Their muscles in the hip rotators and the hamstrings get really tight. So we already worked on the hip rotators. The next one is going to be for the hamstrings, which is the back of the leg, which is where the sciatic nerve runs through. So if the hamstring's tight, it can put a lot of pressure onto the sciatic nerve. So hamstring stretch is going to be really easy. What we're going to do is we're going to sit on the edge of a bed or on the edge of a couch. And all we're going to do is, by keeping a flat back with one leg straight, we're going to gently lean forward and reach for our toe. And you should feel a really tight pull all along the back of the leg into the hamstring. And just like the first two stretches, we're going to hold for 30 seconds. Just reach as far as you can. What I don't want you to do is I don't want you to bounce, because that puts a lot of pressure. So just reach as far as you can. Keep that back nice and flat and reach and lean forward. Once we've gotten to 30 seconds, we're going to alternate and do the same thing with our right leg. And we're just going to reach and again hold for another 30 seconds. So now, out of these first three stretches, which one have you noticed give you the most relief? Leave me a comment in the below. Was it the hip rotator stretch, or maybe this hamstring stretch is giving you the most relief? All right, and like the other two stretches, we're going to gradually add time to our stretching for up to 2 minutes on each side. Start again first thing in the morning, later in the day, shoot for 2 times a day, and those hamstrings will get nice and loose. Okay, and now it's time for the fourth and final exercise for sciatica relief, and that's going to be the Cobra Pose. Now, one of the main causes of sciatica, one of the more common causes of sciatica, is a disc bulge or a disc herniation in the lower back. And the reason the Cobra Pose is part of this routine, because it's the best way to help relieve pressure off the discs in the lumbar spine to help relieve sciatica. So the Cobra Pose is really easy to do. We're going to do a couple of different variations. We're going to start with an easier one, and then we're going to add into a more complex advanced version. So what we're going to do is we're going to lay face down on our stomach. I would recommend doing it on the floor with a yoga mat. What we're going to do is we're going to lay face down. We're going to start with our elbows underneath our chest. And all I'm going to do is push up with my arms like this until I've kind of formed a U with my upper body, but I want to leave my legs on the ground. And I'm going to hold in this position. You should feel some stretch into kind of the abs, but also you should start feeling some relief into that lower back with the sciatic pain going down your leg. So if you have a disc bulge, this is the best exercise you can do. So let me know if this is giving you relief. That's a good sign that your sciatica is probably coming from a disc bulge. Now, as long as you're not feeling any pain doing this, we're going to kind of force our hips into the floor as well. The next variation is we're going to start to move up onto our hands, do a straight arm, kind of drop those hips down into the floor, and we're going to feel a bigger stretch into the abdomen and more into the lower back, and we're going to hold. Again, we're going to start with a 30-second hold, just like all the other ones, and work our way up to 2 minutes. So again, just as a reminder, let's start on our elbows, push up with our elbows, driving those hips into the ground. And then once we're comfortable doing that, we'll come up onto our hands, drive the hips into the ground, and push up with our hands. So those are going to be the 4 stretches for sciatica relief. We have the single kneaded chest, the sitting hip rotator, the sitting hamstring, and then finally the Cobra Pose. Before I reveal the 4 exercises you should absolutely avoid if you have sciatica, let me share some of the incredible results our patients experience from the stretches that I just demonstrated. Our patients have reported remarkable improvement after practicing these stretches consistently. They're able to move more freely without that nagging leg pain that once held them back, whether it's walking, standing, or sitting for prolonged periods. Everyday tasks like bending, lifting, and climbing stairs become much easier, making their routines feel normal again. Many also notice a big difference in their sleep quality, as reduced nerve pressure allows them to rest comfortably without constant discomfort. Plus, they regain the confidence to stay active, enjoy the hobbies, and even get back to exercising without the fear of worsening their leg pain. With regular practice, these stretches not only provide lasting relief, but also help restore mobility and improve overall quality of life. Now, let's talk about the 4 exercises you should absolutely avoid if you're dealing with sciatica. These movements can put excessive strain on your lower back and worsen your pain, so staying away from them is crucial to your recovery. The first exercises to avoid are double leg lifts. While these may seem like a great way to strengthen your core, they put immense pressure on your lower back and can aggravate the sciatic nerve. Stick to safer, low-impact exercises that don't strain this area. Next, avoid bending forward excessively, especially if it involves rounding your back. Movements like bending over to touch your toes may feel like they're stretching the area, but they can actually compress the discs in your spine and worsen sciatic pain. Instead, focus on stretches that lengthen and relieve pressure without folding your spine forward. Third, steer clear of squatting or exercises that put pressure on your hips and lower back. The deep bend in a squat can irritate the sciatic nerve, especially if you're already inflamed. Now, this doesn't mean you can never squat again. It just means it's better to avoid it until symptoms improve. And finally, say no to high-impact exercises like running, jumping, or plyometric workouts. These movements jar your spine and joints, which can exacerbate pain and delay your healing. Low-impact options like walking or swimming are much gentler on your body while still keeping you active. By avoiding these exercises, you'll reduce your risk of aggravating your sciatica and create a better environment for healing. Stick to safe, targeted movements designed to ease your pain and restore your mobility. Now, you've got a simple 10-minute routine made up of 4 powerful sciatica relieving exercises you can do right at home. These stretches are designed to provide quick relief from leg pain, helping ease tension and reduce pressure on the sciatic nerve and get back to living a normal, pain-free life. By dedicating just 10 minutes a day to this routine, you'll not only addressing your current discomfort, but also building a foundation for long-term relief. With consistency, you'll notice improved mobility, less pain, and more freedom to enjoy the activities you love. I hope you followed along. If you did, tell me which exercises gave you the most relief. Was it the seated hip rotator stretch, or maybe the single knee to chest stretch? Drop a comment and let me know. If you found value in this video, be sure to like and share it with others who may benefit. And don't forget to subscribe to my channel for more tips and strategies to help achieve lasting relief, improve your mobility, and regain control of your life without relying on medications or surgery. The next video you need to watch is this one. It breaks down how to tell the difference between hip and SI joint pain. These conditions can often mimic sciatica, so understanding the difference is crucial for effective relief. Click here and watch it now.